Hi, everyone. Thank you for watching Torri and my presentation on Family Violence Prevention Service Act, FVPSA. This is a federal law that supports and protects those who are affected by domestic violence. FVPSA provides funding to support those who need services for survivors and their families. The history of FVPS Act. So it started in 1960s, 70s. There's the women's movement, started to really put focus on the needs of families experiencing domestic violence by opening up shelters. So it started shining a light on these families. And so then eventually the Department of Justice issued a report that examined the scope and impact of domestic violence in the United States, which led to the Family Violence Prevention and Services Act, and which was enacted as Title III of the Child Abuse Amendments of 1984. Stated and latent goals. The manifest goals would include spreading public awareness to prevent family and domestic violence, to be able to provide immediate shelter and sustain hotlines to support domestic violence. Latent goals would be to educate and emphasize prevention to reevaluate what has been seen as usual before the violence escalates. Goal outcomes: create a safe, inclusive, healing space for survivors, spread awareness to prevent domestic violence, advocate for increased funding. Unintended consequences. Unfortunately, not having adequate mental health support in the large number of shelters that they offer, and they cannot keep up with the demand for services because they lack the funding. Intergenerational trauma. So research has shown that witnessing intimate partner violence among one's parents was associated with being 1.96 through 3.01 times more likely to be a victim of IPV, and 1.86 to almost 3 times more likely to perpetuate IPV in one's relationship. So let's break this down. The cost effectiveness, economic impact. When looking at the economic and social effects, we look at ACE scores. So let's address the macroeconomic implications of this issue when it comes to ACE scores, adverse childhood experiences. ACE scores are based on how much trauma an individual experienced before age 18. Some of these experiences can be domestic violence or witnessing this in their home, sexual abuse, parental substance abuse, and other traumatic experiences. Looking deeply into the ACE scores helps us have a clearer idea of what we are dealing with as a society. 58% of the 60 women who experienced domestic violence had at least 2 ACEs in their childhood. 1/3 of all respondents reported experiencing 4 or more ACEs. Economic effects. Children who live below federal poverty line are 5 times more likely to experience 4 ACEs than those who live in families whose income is approximately 400% of the FPL. 1 or more ACEs are associated with an annual economic burden of 14.1 trillion. And then we have 183 billion in direct medical spending and 13.9 trillion in lost healthy life years. This was 88,000 per affected adult annually and 2.4 million over their lifetime. 4 or more ACEs, the per adult cost is $4 million. The CDC says about 64% of adults in the United States reported that they had experienced at least one type of ACE before age 18. Nearly 1 in 6, 17.3% of adults reported they had experienced 4 or more types of ACEs. That's a lot. Cost-benefit ratios. Studies of 10 interventions reported positive cost-benefit ratios, that is, greater than $1 achieved in terms of avoided violence costs for each $1 spent on intervention. So they extended their study of social mobility among the Boston inner city men to 3 generations, including both their parents and their children. 2/3 of the men and 60% of their offspring have moved from lower and working class status into the middle class with the following factors present. So this was a great book that I've been reading about overcoming the odds, where they tracked children that were in dysfunctional homes and kind of tried to see what made that shift happen, that they could take that step, like you saw in the previous slide. In the book Overcoming the Odds, there were some things noted to help children grow into healthy adults after living in a dysfunctional family: healthy mentors outside immediate family, capacity to work in childhood, stronger predictor of capacity for satisfying interpersonal relationships as well, education, scholastic aptitude, military, Which is interesting is also you have the mother's self-confidence coupled with consistent discipline seem to overcome the effects of father's absence or lack of affection, maternal education, and maternal occupation. Mothers make a difference. In order to break the generational trauma, you have to see the benefits of helping these families who are experiencing domestic violence. Current proposals for policy reform implementation still has not passed either the House nor the Senate. So it's called the Family Violence Prevention and Services Improvement Act of 2023. This bill modifies, expands, and reauthorizes through fiscal year 2028 the Family Violence and Prevention Services Program, which funds emergency shelters and supports related assistance for victims of domestic violence. So it requires the Department of Health and Human Services to award grants and enter cooperative agreements and with state and tribal domestic violence coalitions and community-based organizations to support prevention services. Depending on the type of organization, grant recipients must use funding to provide technical assistance, promote evidence-informed prevention strategies, implement coordinated community responses to reduce risk factors for family violence, and develop prevention partnership strategies. How the policy supports human rights and which ones. Article 3 states everyone has the right to life, liberty, and security of a person. Article 5, no one shall be subjected to torture or cruel, inhumane, or degrading treatment or punishment. So we have in Opus versus Turkey, the European Court of Human Rights found that discriminatory judicial passivity and unresponsiveness to domestic violence gave rise to impunity and a climate that was conducive to such gender-based violence, leading to a violation of the prohibition of torture and ill treatment. Furthermore, when a state knows or should have known that a woman is in danger, it must take positive steps to ensure her safety, even when she hesitates in pursuing legal action. In conclusion, intergenerational trauma not only has a cost on families, but a huge cost on our country and investing in helping and healing these families is worth the cost. Though the FVPSA is not perfect, it offers these families a chance on making a change that would not that can spread out even to the next generation. Here's my references. I appreciate you watching and good luck on your next class. Thank you. Bye-bye.